Good morning. Welcome to your session to learn about HR1. I can't say that it will be one of those feel-good sessions, but I think you'll be inspired by the end of it. I am ready to do my work this afternoon. That's why I have my tennis shoes on, and hopefully with the information that you received today, you'll be ready to do your work too. I'm Susan Fraser. I'm the CEO of Jewish Family Services of Silicon Valley. We are an organization that serves hundreds of Holocaust survivors who are mostly in their 90s, living on incomes of $965 a month. We are working with thousands of refugees who have come here seeking safety, fleeing from persecution because of who they are. Many who were Afghan refugees who were given promises by the US military that we would take care of them. And we're working with a lot of families, such as single mothers who are working their hardest right now to keep food on their tables, keep their families fed, and keep themselves housed. HR1 has an enormous impact on our organization and the clients that we serve, as well as our community. On July 4th of last year, President Trump signed HR1 into law. That date was not a coincidence, July 4th. It was a statement. And we are here today to make a statement of our own. HR1 is the largest single cut to American safety net in history. It strips food assistance, health care, legal protection from refugees, immigrants, and low-income older adults and families. The very people that Jewish organizations like ours were built to serve. It does not just threaten our clients, but it threatens our mission. JFS, like many other Jewish organizations, is grounded by Jewish values, values such as welcoming the stranger, treating everyone with dignity and respect, and repairing the world. HR1 challenges each one of these values. Today, we are joined by 4 people who are on the forefront of this fight. We have Abby Liebman, President and CEO of Mazon, Beth Oppenheim, CEO of Hias, Linda Way, Associate Director of Policy at the Western Center on Law and Poverty, and Assembly Member Catherine Stefani's Chief of Staff, Daniel Hertzstein. Unfortunately, Assembly Member Stefani was not able to make it today. She's ill, but we're glad to have you, Daniel. So we're going to jump right into this because we're running a little bit late. And what I would like is if you could each tell us a bit about who you are, what your organization does, and the single most important thing that you think that people in this room should understand about HR1. So I'm going to start with you, Abby.
Okay. I'm clearly not used to public speaking. I'm Abby Liebman. I'm the president and CEO of Mazon, a Jewish response to hunger, a position I've had for 15 years. Mazon is the nation's Jewish response to food insecurity. Food insecurity meaning people don't know where their next meal is going to come from. It is a concept that is broader than just hunger, but it is much more easily understood, I think, as talking about people who are hungry and don't have enough to eat. Our primary focus is on policy and trying to secure a strong government intervention when people are at their most vulnerable and people who are struggling, in order to keep them from struggling even more or to protect those who are on the precipice of falling into a struggle with hunger. The most important...
What's the single most important thing that you want people to know about HR1?
I think Susan did a great job of articulating in a manner that speaks to why this was such a dangerous piece of legislation and why its impact will be unbelievably devastating. You cannot understate what this piece of legislation has done. I'm trying to be very scrupulous in my language here, but I'm very angry. I am angry at those who would vote for something like this. I'm angry at those who would propose something like this. And I am angry on behalf of the almost now 50 million people who are struggling with hunger in the wealthiest country in the world and have no reason to be. That more and more of them are going to be denied the ability to feed themselves and their families, something that no one should have to struggle with or think about in this country. And I am outraged, which makes me energized, which means that the time has come for us to push back, to let our voices be heard on this issue as it is on many issues, because this is at the core of who we are as a people. It speaks to our humanity. That is the most fundamental need that any human being has. That is the ability to feed themselves. They have to be able to eat. If you cannot eat, you will not survive. And this is a struggle that we now have to engage in with the ferocity that we have across a host of issues in the last year and a half. And it is truly a devastating time, but this is a part of that. And this is what we're going to do here. We are going to make sure that the state of California understands what's at stake for it, and that we are here to make sure that California is joined in battle against the impact of this horrible piece of law.
Thank you, Abby. Beth.
Yeah, thank you. And thank you all for having me. My name is Beth Oppenheim. I'm the president and CEO of Hyas. If I were a betting person, I would say that many of the people that we were in the room with over the last hour and a half could trace their roots to Hyas. It is a global organization that works in refugee resettlement and refugee protection, and has been doing so for over 120 plus years. Many of the roots of American Jewry and European Jewry can trace interaction with Hyas and the protection and safety that it provided them to their own family history. And so all of us in this room and beyond have even more of a reason to sort of pay attention to the vulnerability that HR 1 exposes. We nowadays, as a refugee organization that works with all types of vulnerable people because of our Jewish values, as well as working with our family of JFS and JFCS affiliates, have already felt impact of HR 1, even as parts of it are yet to go into effect. So I was struggling with the idea that there's just one thing about this that's damaging, but I would say that the one thing is that it's confusing and that the impact on all types of communities across this state is sort of intentionally nebulous. And nowhere does that impact people more than people who are also confused about their legal status to be here, because that continues to change as well. I'm not usually on panels that are non-refugee or newcomer specific. And for me, this is a welcome opportunity to say that this is a bill that's affecting everyone. And with refugee and newcomer communities here in California, they are perhaps they have compounded vulnerability, and the confusion that all of us in this room and beyond are trying to interpret what the impact of HR 1 will mean on our communities is even harder if you don't speak English. If your case manager that you worked with since you arrived on January 19th, 2025, no longer has a job or only works part-time and has to translate for you what it means that your benefits that you were relying on are going to disappear. That is a type of vulnerability that is beyond just the floor bottoming out underneath you for basic services. So I would say that the confusion and the burden on nonprofits, the nonprofit sector, to translate that both literally and figuratively for the people it affects and will affect is one of the most damaging pieces of this legislation. And I also would say that this is a unique opportunity that we have to build on Abby's optimism and momentum here to talk about something that can impact all people within a particular geography. And instead of thinking about refugee and immigrant benefits as some sort of special thing here on the side, we can talk about this particular piece of legislation as something that is, universally fightable and something that's necessary for all people living in this state.
Thank you, Beth. Linda.
Thank you, and thank you for having me. Linda Way with Western Center on Law and Poverty. For those of you who aren't familiar with Western Center on Law and Poverty, we are the state's oldest legal aid support center in California. Through the lens of economic and racial justice, we fight on behalf of low-income Californians in the areas of health, housing, public benefits, and access to justice through administrative advocacy, legislation, and budget, as well as litigation. I work specifically on healthcare issues, particularly Medi-Cal. As many of you may know, Medi-Cal is the state's public health system that provides coverage to over a third of Californians, over 14 million, and so is really critical. It's been shown to improve life expectancy, meaning it not only means people can live healthier, longer lives, but it's also a critical anti-poverty tool, along with food benefits. This is one of the state's most effective anti-poverty tools, as it's been shown to reduce mortality, but also reduce poverty, eviction, homelessness, and better health outcomes. And so just to paint a picture of how critical the Medi-Cal program is and what coverage means, I'd like to talk a little bit about what Medi-Cal looked like before the Affordable Care Act, before 2014, when really the only people who were eligible for Medi-Cal were older adults, people with disabilities, and very, very low income children and their parents and caretakers. And that was based on the idea of the deserving poor, that only people who couldn't be blamed for their poverty were deserving of health care. California rightly expanded Medi-Cal coverage to individuals without dependent children, and later also regardless of immigration status. And so these expansions were monumental in reducing the uninsured rate from 18% in 2013 to about 6%. Unfortunately, those gains are eroding through, in large part due to HR 1, but also the state's response into HR 1. We know that HR 1 is just a way to make cuts, and these cuts are used to fund tax breaks to the wealthy. So-called work requirements, we know from other states, Arkansas, Georgia, they don't work. They don't actually improve employment, wages. They result in cuts in healthcare coverage. And so we can expect that to happen in California. We know that Medi-Cal adults are already working. Over 60% of Medi-Cal adults are already working, and the majority of those who aren't are not working because of illness, because of a disability, because they're a parent or caretaker, or because they're going to school. And so this is really punitive red tape meant to terminate coverage to benefit tax breaks. And so we do have a package of bills meant to address this. Because we know that these are not just abstract policy outcomes, but they have a real human impact that impacts all of us. We know that when people don't have health coverage, when parents don't have health coverage, they're unlikely to go, they'll miss their checkups, and so they're more likely to end up in an emergency room. We know grocery store clerks who may miss their medicine, may miss work. We know community clinics who lose Medi-Cal patients will likely close down. And so this has an impact on not just a policy level, but these are our neighbors, our communities, and our local economies. And so we do have a package of bills that we are co-sponsoring, and want to appreciate Daniel for being here to represent Assemblymember Stephanie, as she is taking the lead on one of our bills that I'll defer to him, but we'll just briefly mention our three other bills with Assemblymember Bonta, which is meant to reduce work requirements, burdens on individuals by automating the process, utilizing existing data sources, but also not going beyond what is federally required, not amplifying the harms by only applying it to those who are subject to the work requirements, and that excludes state-only immigrant populations. And secondly, AB 2201 that streamline the renewal strategies so that people can keep their Medi-Cal. Eligible people are not being terminated for paperwork reasons. And thirdly, SB 1202 by Senator Weber Pearson that creates a public dashboard so that we can actually measure the impact, the harm that HR 1 does through looking at application numbers, disenrollments, terminations. We know that these harms are coming, and even with our best efforts, 2 million people are still expected to lose Medi-Cal coverage. And so
Thank you,
these are
Linda.
real harms.
Thank you. Daniel.
Thank you. Good morning, everyone. My name is Daniel Hertzstein. I'm Assembly Member Stephanie's Chief of Staff. She so wanted to be here with you all today to share a little bit more, and I'm grateful that you've allowed me to come and talk a little bit about the work we're doing. I think I just wanted to start a little bit with the scale of the problem. You just mentioned 2 million people are going to be potentially off of Medi-Cal. Another million people are going to lose food assistance. We're talking about, in California alone, 3 million people losing access to healthcare and food. Those are seniors, families, children, refugees, our neediest neighbors who are being taken away, having their most basic rights removed. Really vital pieces. And so here in Sacramento, we're doing a number of things to try to fight back. Legislatively, we have a number of bills that help to combat some of these issues. AB 2208, which is sponsored by the Western Center, does a number of things, but it limits copays to 1 cent, because you can imagine for someone at the federal poverty line of $15,000 a year, a $35 copay for medical care is a barrier. It also allows retroactivity for Medi-Cal for 3 months, so that if you do lapse, and there are all sorts of new requirements and work requirements and verification requirements as part of Medi-Cal, as part of HR 1, if you do lapse, you can retroactively look back to 3 months. And then finally, it also adds some enrollment system improvements to make sure that we help people get on Medi-Cal and keep those people from falling off again. 2 million people estimated to fall off of Medi-Cal due to HR 1 impacts. Assemblymember Stephanie is also a member of the Budget Committee, and California is stepping up in major ways to attempt to backfill some of those dollars, and we're talking about billions and billions of dollars in lost funding from the federal government. I think we're going to have to make some very tough choices, and the governor has a revise of his budget due out this week, and so we'll see sort of where we're allocating funding. But those are places that we will continue to fight for to make sure that we are funding our food programs and funding our healthcare programs.
Thank you, Daniel. And thank you, all of you, for those great responses. One of the things that really strikes me is that there are multiple crises that are going to happen within HR 1. But at the end of the day, they affect humans, and they affect a family, they affect an individual, they affect an older adult. And I would like to go in a little bit deeper, if we can, so that people can really understand what is the human impact of HR 1. When we're talking about food insecurity, what does it mean? What does it actually mean for somebody to be food insecure? What does it actually mean for a refugee to not get their status that they had expected that they would get? What does it mean for a refugee to not receive Medi-Cal or CalFresh benefits? What does it mean for a Holocaust survivor to not have access to health care in the way that that person might need access to health care? If you can all help us to dive in a little bit deep, and let's really look at that human impact of what does this truly mean for people as they try to live their lives. And I'm just going to open it up. You can start wherever you'd like to start.
I'm happy to start. So another one of the bills that we are working on this year is AB 1734. It's a response to cuts to hunger survey. And the Trump administration has cut all funding for counting how many people are hungry. There's a food insecurity survey. And our bill would restore it. And through that work, we met a woman named Greer. Greer is a single mom, mother to a 8-year-old with special needs. And she's struggling. She's struggling with unreliable housing. She's struggling with health issues, and she's reliant on CalFresh to feed her and her child. And through this process, she's really spoken very powerfully to us about the fears and the stress of living on those benefits and the fears and stress caused by the federal government taking them away. And those stresses impact all other pieces of her life. So now you lose your food benefits, and she talks about, she loses her ability to parent, her mental health goes down, her physical health goes down, and she's really reliant on, in this case, she's reliant on the San Francisco Marin Food Bank for feeding her, but it is a really scary time. And this is a woman and a child who are just trying to live and create a life for themselves, and she's seeing the impact firsthand of having food stamps taken away.
Okay, I'm going to follow that, and I'm going to take this a step further, okay? Because I think we're trying to get away from numbers. I think the idea that we're talking billions of dollars. The nutrition safety net in this country is incredibly expensive. We spent $100 billion a year on the SNAP program, which is CalFresh here. That is a huge amount of money. This is the largest cut to that program ever. The program's benefits have risen and fallen with need and over time based on what food costs. No one's ever dared to step in and say, we're going to get rid of this program. That is what's on the horizon in our Congress. Make no mistake. This is just the beginning. In thinking about what this means, I want to do a little bit of I promise it's a minute-long primer on the charitable food system. In America, the charitable food system is the overall top part of that is food banks. A food bank's like a warehouse. The clients of a food bank are food pantries. Those are places where human beings can actually interact with a food resource. That is where you can get a bag of food, a box of food. Can you get it every day? No. Can you get it every week? No. There is a schedule. And many of these organizations cannot afford to be open every day, and they cannot take the place of the federal government. So people have nowhere to go. So the answer to your question is, I have no idea what the hell this is going to look like, because this country hasn't seen this for 100 years. And when we saw it 100 years ago, there were many fewer Americans and many fewer food insecure Americans. So the idea that you lose your SNAP benefits and you have somewhere else to go is a fantasy. There's nowhere else to go. You're going to eat your clothes. I don't know what you would do.
So, Linda, let's go in a little deeper with that. I am a social worker, so that's the tendency I have to go to. Can you talk a little bit about, and I'm sorry, Linda, I haven't meant to say Abby.
I'll just change my
Back
name.
over.
I was thinking, that's interesting.
What
You were
happens to
looking at me.
people when they don't have access to food?
I think they do what they can to piece things together. This is what they do. And people, I know also, MAHA wasn't really on the agenda here, but I have to tell you, some of that is just laughable to an advocate like me, because I'm like, seriously, if people could have enough money to eat in a healthier way, believe me, they would. But people do not get enough money. When you're looking at what is essentially about $18 per person per day, you go into a grocery store, the ingredients for a ratatouille will cost you $30. It's much more financially smart to buy 2 boxes of mac and cheese that cost 99 cents. So the idea that people don't want to eat in a healthy way is ludicrous. It's all about the fact that there isn't enough money to do this. So what do people do? They make do and they stretch things, and people go without food. Parents do not eat so that their children can. You know, I've heard stories, people, when I do conferences like this, there are absolutely people in this room who grew up, whose families got SNAP. And one person came up to me once in Philadelphia and said that he can remember coming home from school and opening the refrigerator, and there was only 1 apple in the refrigerator and a carton of milk. And he gave the apple to his younger brother, and he didn't have any snack. And, you know, so again, you may have a better answer than I do, but as far as I know, you just don't eat. When I first came to Mazone, one of my oldest friends, Sheila Kuehl, who used to be in the legislature, said to me, you know, when people are homeless, they can sleep in a doorway. When you are hungry, you cannot eat the doorway.
Well, and we know that there are so many implications for people that don't eat. And think of our Holocaust survivors. Like I said, we are serving hundreds in Silicon Valley. Most of them are in their 90s. And when they don't have access to food, they lose their strength. They're not able to metabolize their medications like they're supposed to. They become a risk for falling, and then they become a risk for institutionalization. And so when you really drill down on what does it mean to not have access to food, it is truly lethal for people. And that's kind of why I was asking that question, because I think there's a lethality to not having access to food. Beth, can you talk a little bit about the implications to refugees?
Yeah, sure. And I want to draw on the fact that while I'm going to speak about refugees, the human experience that we're all talking about here is really what I want to emphasize. Sometimes when we other the experience of refugees in terms of the impacts on policy, that is also incredibly dangerous, and I want to try not to do that. So one of the things, all of the shared experiences of what it would be like to be a relative newcomer, to not understand the systems and the complexities that I spoke about before, they still stand. It's a very complex system, even when born and raised in a particular environment, but the impact of this on refugees will be the concrete, the lack of healthcare benefits, the lack of food benefits that they depend on arrival, but also going back even a step further to a broken promise of a safety net that their unique pathway into the United States provided them. So many of you know, I always say that to describe refugee resettlement is to do an elevator pitch, but the building has to be 100 floors long. It's not exactly a quick thing to explain, but one of the things that is a reality for many of the newcomers that have arrived is that they are facing obviously unprecedented discomfort and threat publicly in public sentiment. They fear to leave their homes. They fear to access the benefits that we are all worried about them going away. So even if they are there, they may not access them unless they have good advocates alongside them who may look like us to be able to stand alongside them and fight for them. So that's one of the realities, the fear of even accessing these things. The other is the fact that H.R. 1 leaves a real void in legal service provision for refugees and immigrants who desperately need that. It is not enough now, nor has it ever been, just one quick step to have a refugee arrive in this country and then they're sorted and can go and live their lives. They have a lot of legal hurdles to jump through, and that has only become even more and more the case since this administration in Washington took over and gutted the refugee protection system that many of us know and understand. So their ability to have documentation, to be able to have employment authorization, to renew that employment authorization and to have staff alongside them when they do it, that constrains even further the bit of space that they may have to address some of these concerns themselves. And the last thing I'll say is that, you know, this is one piece of a much larger gutting of the social safety net that protects refugees and immigrants of all types of statuses around the country. We learned about the real-time threats watching Minnesota unfold on our screens. But one of the things that was behind that was a conscious effort to sweep up resettled refugees in an action that was to target lots of different types of immigrants in this country. And we only await further policy that will put resettled refugees at threat in this state, and what will happen if they have these compounded vulnerabilities that do not allow them to access the legal protection that they need. We don't have enough attorneys, full stop, but even the attorneys and accredited reps that we do have cannot keep up with the volume. My inbox is full of people trying to access legal service. It is the number one ask before all of the other things that we've discussed on the panel today.
And Beth, can you tell us what happens if they don't receive their legal status?
Well, the short answer is that any possible temporary status at the moment is being used to expedite removal. So people are put into legal proceedings. They may get detained, indefinitely taken outside of the state to detention, depending upon their particular status. And it puts their entire family at risk if they are part of the connective tissue that holds that immigration case together. That is something that is putting children, even U.S. citizen children separated from parents, we've all seen videos of various kinds on our screens about that, into even more vulnerable situations where they may not have the ability to access healthcare, to access food, or to have even parental guardians who can do that for them.
And we're not talking about just a small number in California. We're talking about, I think, 90,000 that arrived in the last 5 years.
That's right. Over 275,000 nationwide.
Linda and Daniel, did you want to talk about the human component of HR 1?
I'll start. I think that Daniel already discussed some of this. And so quite simply, it means people are going to live shorter, sicker lives, unfortunately. And we know that the people who most benefited under the Affordable Care Act, the working poor, individuals experiencing homelessness, those are the ones who have the most to lose. When you think about some of the challenges to keeping Medi-Cal right now, we know that people have been terminated due to paperwork reasons. And so when you add on not having a stable housing, I expect a dramatic decrease in the number of people experiencing homelessness having access to health coverage. We know that we've heard from parents of providing care for their children or even adults who have high health needs, that they are scared of losing their coverage and their kids' coverage. Even though there are exceptions in place, we know that people fall through the cracks, that this is about burying people in paperwork to cut coverage. And so even though these exceptions exist, there are a lot of people who are going to lose access to Medi-Cal because of this complex, burdensome process where they are literally buried in paperwork.
Daniel, did you want to add to that?
I guess I'll just add, so I told the story of Greer, the single mother with a special needs 8-year-old who's struggling, right? And what that means for her. But I think stepping back a little bit, 1 in 7 Californians is on CalFresh. Almost 50% of them are children. And so as we're telling these human stories, I think the federal government is imagining the lazy person who's not working, and we've just put in new work requirements to get these benefits. But what we're really talking about is taking foods away from kids, right? Like it is the actual like human of it. And you walk outside today and you walk down to the Capitol and you walk past 7 people, and statistically, one of those people is on food stamps. And so the scale of it, and we've heard a little bit about what happens when we take away food, which is that people die. It is really, really overwhelming, I think, when you sort of put it into that kind of context.
I think one of the things that really resonates with me is that the irony of this is that we know that when you wrap people up in the services that they need to be able to thrive in our communities, there's actually a cost savings, because people who are getting access to care are not utilizing the healthcare system in the way that they would if they were having a crisis because they weren't getting care. They're not going into institutions. And let me just say, in our public hospitals, the cost of a hospital stay is around $6,000 to $7,000 per day. And nursing home institution is somewhere between $8,000 and $10,000 a month. And so there's a real irony around this, that this is supposed to be saving money, but in the long term, we're talking about people who are going to have to be using our emergency rooms, who are not engaged in preventative health care. And I'm wondering from our panel, I know this is a loaded question, but How do you make sense of this from a political and a moral standpoint? I said it was loaded.
Maybe coming at this from both the national and the local side, one of the things that I think, this may be somewhat controversial to say, but it makes perfect sense if you are thinking about the fact that the idea is to prove the larger case that nonprofit organizations are meaningless. They are tools of the left, or whatever kind of term we want to say, that they are ineffective, and that, look, people still suffer. Look, refugees access public benefits, and that's bad. Why do they do that? These kind of larger arguments. Then this erosion makes perfect sense, because it is actually creating an environment where those proof of concept, if you will, bear fruit. Resettlement agencies are but one type of agency that sort of have to confront on the regular basis the fact that we are trying hard to prove the absolute opposite in a resource constrained environment where the policy narrative changes on a dime, where the actual implementation guidance of what to do from our many decades long partners changes from one Monday to the next, and we have to keep up, and it's our fault if we don't keep up. So from a moral standpoint, if you're thinking about that, the only answer, in my opinion, to all of this is not only moral outrage, although that is, of course, why a lot of us are in this room. We want to be able to actively do something. We want to be able to share that outrage with people who have more access to power than us. But I would make the argument that the power exists in the collective, and not necessarily only in the lobbying moments that we have in front of someone who is able to impact a policy or to help craft a bill. We have to be able to name the fact that this is very purposeful. It is clearly not grounded in the morality of where a lot of faith traditions come from in terms of coming to this work, and it is clearly not grounded in the safety of communities, whether they be newcomer communities or the communities that exist there that welcome them. It is an erosion of that. And so I make sense of it to say that it makes perfect sense if you are Stephen Miller, but it doesn't make perfect sense if you are a regular, caring, moral human being.
I mean, morally, I don't think I could. I mean, the answer is no. I can't make moral sense of it. I think politically, like, you have to find a way to make tax cuts for billionaires somehow, and there's a math problem, right? And so I think when you're, the simple addition that we all learned in elementary school, right, is that if you want to make those major tax cuts, the money has to come from somewhere. And if you're Donald Trump, why not take away food and healthcare access from the sick and the poor?
I actually think that, I'm not quite sure if this is where you're going, Beth, but for me, it could be because the focus of our work is slightly different, although we really also prioritize the food and security needs of immigrants in this country. And to me, so morality is a little bit of obviously it's a subjective concept, right? So there's a history in our country of speaking of our collective values as Americans. Those are often grounded in what mostly it was the Judeo-Christian values that most of the founders of this country embraced. Mostly heavy on the Christian, probably that. So I think sometimes it's very difficult, like when you're up on the Hill, where you get pushback from very fundamentalist religious practitioners in Congress who will suggest that what they're doing is the moral thing, and the moral thing for them is actually abhorrent to those same values that this country embraced for 250 years. So it's perverting what those values are. So the idea of like you should be self-sufficient in some way. That's what they value. That's an important value of independence and a lack of dependence. Again, all that judgment that we as Jews that you referenced earlier, right? We don't We don't do that. We don't judge fellow human beings. That's not our job. How you got hungry, none of our business. It is our business to make sure you get out of it. And the idea that people are cheaters, that they come with these assumptions about the values that people who struggle have, that they've made assumptions about them being morally bankrupt in some way, when I would argue it's those who are taking away from them are the ones that are morally bankrupt, and that is what HR 1 is. HR 1 is, in fact, an expression of the moral bankruptcy of the Republican Party, that they don't care, because picking up what Daniel said, they have a different priority. Their priority is really about capitalism. I can be controversial too, which is the idea, right, that that's the most important thing, is that people get rich. And that is so much more important than whether or not people are fed, people are protected from another violent extremist government that wants to kill them, so they flee here, people who are desperate because their child is sick and they need help. All of these things that work together, all of these people are accused of having no moral center. They are just takers. And that is a lie. It is a complete and utter lie. And it is those who accuse them of that, because with the Republicans, as is true for Trump, every accusation is a confession. And not my quote, but I forgot who said it. Anyway, it doesn't matter. It is true that this is what they're saying. We don't have any morality here. Throw your morality out. That's childish. We don't believe in it. It's immature. That we believe in the idea of richer people getting richer, and people who struggle just have to figure it out, which is what you were asking, right? Is what are they going to do? They're going to die. That is literally what is going to happen. People will start to die. That is not being overdramatic. That is not hyperbole. It is already happening. People are dying. And what will happen because of HR 1 could happen in California. I don't think the governor will let that happen. But there are states who will say we can no longer participate in SNAP because it will cost us too much, because of the shift in the administrative cost from 50% for the state to 75%, and because of the fact that for the first time in its 100-year history, states have to bear a percentage of the cost of the actual benefit. In California, it's all based on punishing states who make mistakes in how they process applications. California, it will cost $2 billion. $2 billion that no one planned for. So many states faced with numbers like that go, we're out. What will happen? What's going to happen to those people in those states? There will be nothing for them. No reduced benefit, no limited opportunities. And the charitable system doesn't substitute for that. What will happen?
So that actually leads me into my next question. And this is going to be my last question before I open it up for questions from the audience here. But you led me into this question, and that is that California has expanded Medi-Cal and CalFresh far beyond the federal limits, right? And now that that federal floor is being pulled out, what is truly realistic in terms of what California has the power to do or doesn't have the power to do? So
I'll start. Having worked on legislation and budget, I would start by saying budgets are a reflection of our values. And even though the federal government is taking a step back, California has shown in the past, but as you pointed out, that we can go farther, that we have gone farther. And so even though, and just to go back to the idea that, again, these cuts on the backs of low-income Californians, low-income Americans, are to fund tax breaks to the wealthy. California can step up and look at progressive revenue solutions. I know there are different proposals. And so it's not just a expenditure issue, it's a revenue issue. And we can look at both sides of the equation, particularly on the revenue side, and look at progressive revenue solutions that support our safety net programs. We know that there are different proposals out there. On the Assembly side, there's Water's Edge. On the Senate side, it's framing it more in terms of a tax paying their fair share, because the employers that benefit, the people who are shifting off of Medi-Cal are being shifted off due to tax breaks, as I mentioned. And so we, as a state, can look at progressive revenue solutions. No, it's an election year, that is challenging, but to align with California values, our values that people should not go hungry, should not lose access to healthcare services, we really do need to look at the revenue side of the equation.
Maybe I can talk about the expenditure side. I think there's a number of things that the legislature has been doing to try to backfill. And so immediately after HR 1 passed, the legislature took budget action and funded a number of our important priorities, including $70 million for abortion services, $90 million for Planned Parenthood, $15 million for gender affirming care. On the food side, we spent $20 million for emergency food bank support, $40 million in county CalFresh implementation support, and another $83 million to reduce payment errors for CalFresh. We need to do a lot more. And this year, I think what we will see, and again, as the budget gets negotiated over the next month, is where we are making those targeted investments. And I think the kinds of things that Assemblymember Stephanie will fight for is making sure that we are funding Medi-Cal for people with unsatisfactory immigration status, making sure that we are doing the work to help fund counties who are having to hire hundreds of new staffers to do the new verification for both CalFresh and Medi-Cal. And those are investments that need to be probably in the billions and sustained over the next number of years. And so I agree absolutely that the budget has a big piece of it. And here in California, I think we are making strides. But the other pieces, right, without new revenue, we have a tough budget situation. And we are going to have to make some really tough decisions around what gets funded.
It certainly speaks to the importance of our advocacy and lobbying efforts here today, that there is still room for making change.
So can I say, I just want to say one thing here, and that is why there are people who are policymakers and why we have elected officials who seek government office and the authority and the responsibility to problem solve this stuff. That's not my job. My job is to make sure they do it. My job is to make sure that they fill these holes. And California has to. That is just it. They just have to. So how they decide to do it, I don't understand all the intricacies of how the state finds money for things. Somehow we often seem to. And again, it is about your priorities, right? It is a value statement. A budget's also a reflection of what policymakers have as a priority. And if you don't see these vulnerable communities that should not be made more vulnerable as your priority, then you have no business in public office. And it is hard. I get it. It's hard. It's hard to figure out. It looks like you have to make terrible decisions and really hard choices. That's the job. That's what you signed up for. My job is hard. My job is to make sure that you understand that I will hold you accountable for your failure if you do not do the right thing and fill in the gap that this Republican-led monstrosity has foisted on a state that has always prided itself on taking care of its people, all of us.
Is that what you're going to do today?
No, I'm actually flying home before that. But I thought if I could wind up all these folks, I might go ahead and do that.
Did you want to say something, Beth? Okay. Miller just informed me that we have a few more minutes than we thought we had initially, so I have yet another question. Beth, you mentioned when you introduced yourself how complex and confusing HR 1 is. And, in it was November of 2025, there were SNAP cuts. In October of 2026, there will be changes to Medi-Cal. There will be more changes to ACA in January of 2027. And I don't know how easily this is answered, but how do we keep our communities abreast of what's happening? Because it all just gets jumbled together, right? And so how do we keep our communities informed, and how do we keep ourselves informed about these crazy timelines that are happening?
Yeah. That's a great question. So I think one of the ways that we're doing it at our organization is obviously trying to pair the information that we know to be true, the information about what might or might not be true in 6 months or 1 month or 1 week's time, and the right messengers to deliver that to our communities. So as a national organization that is and an international organization, that means that a lot of what we spend time doing is taking the information at the Washington level, trying to, through a lot of our local affiliate offices, translating that to the state level and the community level, and then figuring out who the right community advocates are to actually get that information out into the community. It's I wouldn't say the easiest or most time efficient process by which to do that, but it's important because it's not only about making sense of the policy, but it's about having someone who community members who are affected by that policy trust deliver that information to them. I can't express how important that is in refugee and immigrant communities. I'm sure everyone in this room knows that, but particularly for those who came to this country through a very regimented process, such as refugee resettlement, they tend to sometimes wind up in communities where they may or may not have community ties. For Afghans, that's luckily not the case in this state. There is an incredibly robust community infrastructure for Afghans, but also policy changes that affect that community have been happening from one day to the next, quite literally. And what we do is we partner with advocacy organizations that have the trust of those communities in order to deliver those messages. We don't need to brand it. We don't need to even have a role unless our role is helpful to kind of connect those dots for the communities themselves. And then the other thing that I'll say in terms of having to make sense of it, frankly, we've had to invest and I know that this is a resource-constrained environment, and depending upon the organization that you come from, this may or may not be possible. In non-traditional partnerships across organizations who might be able to translate the same message in several different ways to different communities. So if hunger is your main issue, or if healthcare is your main issue, perhaps you have a different type of message, but it could be packaged in a way to speak to a particular community that needs to hear all of those messages at the same time. The ability to take the burden off of the immigrant or the refugee or the vulnerable single mom to have to hear that message in different ways or source the information from different people, that's what we try to do because the policy is not getting less confusing. So our job is to actually make the entry point a little bit more clear and more efficient for them.
Maybe if I can just add, I think the other piece is the government has some responsibility to be proactive here, right? And, one of the things that we're hearing, I'll give you an example from San Francisco. San Francisco has told us that the Human Services Agency needs to hire 72 additional people just to do the new verifications just for that one county. But those folks who work at the Human Services Agencies are also the ones who should be reaching out to someone when their benefit's about to expire, helping walk them through the process, right? And so part of that, I think, is on a local level, our governments have some responsibility to protect people. And one thing that makes me really sad about that is San Francisco is going to invest, the county of San Francisco will invest in hiring those people. A rural county in California probably won't. And so you will have folks who are lucky enough to live in a county with more money and more resources and frankly, more moral character, investing to make sure people stay on these programs. And then folks in less resourced counties, losing those benefits across the board because those counties haven't made the investments, the proper investments to hire those additional resources.
Linda, did you want to add to that?
Sure, and just to echo Beth's comment on trusted messengers, having worked closely with particularly within the immigrant community, how important that information is coming directly from trusted messengers, but also in a language that they understand, and it being user tested so that. You'd be surprised at how many government documents it seems like it's a Google Translate, and so actually being able to have the information in an accessible manner, which is what some of our proposals do, is increases the outreach that the state, counties, health plans must do, but also that that there is some work with community-based partners, members, as well as that this is tested by users so that it is actually understandable, that these changes that are constantly changing. I mean, I think even in October, some of the changes on the budget side are not decided. For instance, the governor is proposing to cut Medi-Cal, full scope Medi-Cal, for certain immigrants, including refugees. That is more expansive than HR 1 demands. And so we are fighting as advocates against that cut. And we won't know until next month what that actually looks like. And so it is challenging in a constantly evolving environment, but that's why working very closely with community members is so critical.
May I just add one last thing to that, since you mentioned it? I think these close timelines also play a role in how we're able to translate this into advocacy in Washington. Yes, advocacy in Washington is still happening, even if it may feel a little bit lonelier than it used to. Because if you think about it, these decisions that affect certain populations within this state, then we have a narrower window to advocate for the federal benefits that they may be able to deal with at that particular time between the end of May or the beginning of June and September for the federal fiscal year. So that also further constrains advocates as well.
So, thank you, panel. And now some of the hard questions are coming because they're coming from the audience. And so, does anybody have a microphone? Miller, do we have an extra microphone? Can we use one of yours? Okay, and there's a question over here.
So my question is, given the complexity and ambiguity of HR 1, has there been any legal challenges to try to actually hold the line and give us more time so that these cuts do not go into effect until we have more clarity and more time to figure out what this looks like?
Let's hear from our policy folks here.
I'll start on the Medi-Cal side. There's certainly an option to request a delay, and California has done that on the work requirement piece of things. We've requested that option, but in talking with state leaders, they don't think it's likely that as a blue state, it's unlikely that the federal government will approve this this request. And so in terms of actual legal challenges, I think what I've heard from state partners is that they're working closely with other states, not just blue states, but red states who have also voiced concerns. This is, we often hear the term building the plane as we are flying. This is doing that, and that means that people are going to be cut off just because of the chaos that this has. And so there are efforts underway. They don't look very positive.
Daniel, did you want to add to that?
I mean, I don't have much to add, and certainly don't have any optimism to add in terms of, successful challenges. I think from my perspective, all of my optimism comes from the ability of us here in California to fight back, and what are the opportunities to do that. But I don't have anything to add on the challenging at front.
So first of all, at this moment in time, there is still an effort underway to get the United States Senate to delay the implementation of this shift in the payment of benefits. So that the request didn't make it through the House, but on the Senate side, as they're looking at appropriations bills and the Farm Bill, to try to push for the fact that if we could just get a delay in the implementation of how you calculate the error rate. Remember, I sort of referenced this, is that work requirements under SNAP are now tied to states' so-called error rates. And states are scrambling to figure out how to even calculate these and have enough time to figure out what that would be and what this would cost. And it's all very vague about how this formula is going to work out. So there is some effort to try to get these to just slow down. And the Senate could do that. And then obviously they have to go back to the House. God knows what they'll do. But there is still some pushback happening at the federal level to try to slow this down. Possibly, I think, to slow it down enough that the midterms happen. Something might change. So there is that. Whether there will be legal challenges or not, there's probably not ripe for that yet. Probably some of this will have to be as it is implemented and we begin to see what some states do. So if you're in a state, let's pick a random state, Alabama, Louisiana, Tennessee, Mississippi, and your state says, oops, sorry, we're not going to have this program anymore, I imagine there'll be lawsuits about that, that you cannot just opt out of this entire program in some way or another. I have no idea how you'd make that case, but I'm certain that there are lawyers who will try to do that.
So we're going to be on watch duty for a while. Other questions? One over here and one over here.
Yes, thank you. One thing you haven't talked about is the housing crisis in the state, which we can do something about in order to make housing much more affordable for people so that they have more resources to spend on the other things their family needs. And the other thing that you haven't talked about as a source of income, which I think is readily available, is to do away with Prop 13 so that the people that have these multi-million-dollar houses are paying a fair share of their taxes.
Daniel?
Thank you for the question. I mean, just to start, absolutely, we need to be building more housing, and we need to be lowering the cost of housing for Californians, and certainly has a downstream effect of allowing more money for healthcare and food. We have a bill this year to give you an example of how hard it is for someone who is maybe on Medi-Cal and who is receiving CalFresh benefits to get into housing. It turns out that in order to get into supportive housing, if you are homeless, you have to be able to show documentation that verifies you are homeless. Which is crazy, because what unhoused person has access to the number of documents that you would need to prove this? So we have a bill this year that would just say you can self-verify that you are unhoused in order to get into that's supportive housing, because a number of these supportive housing units are actually sitting vacant for a really long time because it is so hard to jump through all of the hoops. It's the same reasons why all of the new verification requirements for both Medi-Cal and CalFresh are so devastating, because when you are already struggling in life, you are not making a lot of money, you might have other health problems, substance use issues, whatever it might be, then asking you to also jump through hoops to get basic services or to get a home makes it really, really challenging. And so on the housing front, I will say, one, again, we need to be building more housing, but two, we need to be lowering the barriers for especially our poorest neighbors to get into those homes that we already have built.
I'll just add, I think that goes to my comments earlier related to progressive revenue solutions and really looking at that. Unfortunately, when you have a legislature who, in an election year, there are challenges, and to Abby's earlier point, and that's why we need to push them. I know there's been efforts in the past related to repealing Prop 13 and conversations of maybe then doing a split so that focusing only on corporations versus private residential, but even that has faced uphill challenges. And so I think these are important conversations to have as part of revenue solutions. And that we need to push our lawmakers in that direction, because these cuts have real impacts that are being felt right now, not just in October or January.
Just on the revenue front, the other piece I will add, the Howard Jarvis Taxpayers Association just qualified a ballot measure for November that would cap transfer taxes. So that's the tax you pay on a sold property at 1.5% or something. Counties across California are getting hundreds of millions of dollars from transfer taxes. So not even in the new revenue category or the changing of Prop 13 category, we're actually, there's a threat of going the other way, which is losing billions of dollars in tax dollars from transfer taxes.
Thank you for that question. We had a question over here and one over here too.
Hi, so what do you expect in the May revise? Because the governor had no money in there to replace what the counties lost in realignment revenue when the Medicaid expansion was implemented.
I'll start. I mean, that's pretty, we'll know come Thursday what that looks like. I'm not feeling optimistic, even though we're hearing revenues are higher than originally projected. We're being told that is short term. This is only for, this is a blip. It's not a sustainable or long term, but also warnings that any increases because of Prop 98, half of it will go to education. And so even though revenues may look slightly better, that's not what we're hearing from the administration, that there'll be new investments. In fact, we've heard some concerns that there might actually even be some cuts more drastic than what was in January. And so what advocates are bracing for is a fight, and a fight to maintain what we currently have, and push where we can. But I'm not hearing great things about the May revision.
Yeah, I think that's probably similar to what we're hearing, and again, we'll know sometime this week probably. I do think that's then when the legislature gets to step in, right? And we are lucky to have a system where our local elected officials get to have some say too. And so I do think there is in the legislature some amount of energy and desire to add some of that back into the budget, but I don't have a huge amount of hope it's going to come in the May revise from the governor.
We have 5 minutes. A question in the back here. Can you get the last question, Miller?
I'll try to make the question quick. You've touched on public policy reasons for why the cuts to Medi-Cal are counterproductive, besides the moral reasons. I was hoping perhaps it's Abby who could talk more about public policy benefits of CalFresh and why it's ludicrous that our economy is being so impacted, not only our fellow humans.
I'm so sorry. Do you mean why it is that
The powerful impact of the dollars that are multiplied. I don't have the full background, but I think you do.
I'm not the numbers person. I have because first of all, when people get CalFresh, you actually may already be employed. People, I think that there was some allusion to that with Medi-Cal too, is that people on CalFresh benefits often are working. So that CalFresh, like SNAP in any other state, is actually an economic driver. People spend their money, they spend the money locally, they're spending it in their community. The community is then able to sustain and support retailers and even wholesalers that provide food stuff. I think, is that what you're getting at? Is this idea that, okay, yeah, so it is economic the economic intricacies of all of these programs that were always a part of the design was that they would be driving the idea of economic growth wherever they were, and that is the purpose behind a lot of these programs, is to drive that kind of growth and to get people on their feet and able to have the capacity to earn and spend, and those who cannot, that these systems provide financial resources into communities where those who need to be sustained in some way, either because they are too frail to work, they are disabled in some other way, or they're elderly, and we don't expect people to go back out and work in fast food chains when they're 78 years old. Well, we didn't anyway. And that those things are actually driving economies. So there are good economic reasons. My experience in being an advocate is people fall asleep when I start to talk about that. So that is not, I think, where people's energy around understanding why this is really powerful and impactful and important, why these programs have existed for 100 years or more, and that they are in fact a reflection of who we are, which we've all alluded to, is that if these are the ways in which we want the world to know and understand what America stands for, what California stands for, then we have to stand up and say so, and we have to stand up and defend these kinds of systems that have made it possible for all people to not only feel welcome, but to feel supported and to understand that when they're vulnerable, that their government will step in and protect them and not attack them.
Okay, we have hit our time mark. I really want to thank our panel here today. You have such exceptional leadership, and you are what gives us hope. And you are what helps us to keep our Jewish values alive in our organization. So I really want to thank you for that. I have an announcement that I'm supposed to make here, so bear with me for a second here. We're now about to head into the lobby training and practicing for lobby meetings this afternoon. Please look at your name badges. In the bottom left corner, you'll see your lobby group number, which should match the number your group leader emailed you a few days ago. The air walls are about to reopen, and I would like to invite you to find the table number associated with your group number. We ask that everyone be seated with your groups in 10 minutes at 11:25. Oop, that's about now. So Jewish California can begin a brief lobby training and give you as much time as possible to meet with your groups. Once the training is complete, your group will have until 1 p.m. to go over who you will be meeting with this afternoon. Thank you. Go get them this afternoon.